Okay, welcome back everybody to session 2. We're going to look at a few different things. We're looking at the psychological support throughout the patient journey and also some new treatments and hearing another survivor story. My name is Jo Gray. I'm the CEO of the Association for Multiple Endocrine Neoplasia Disorders, or AMEND. And as part of our charity remit in the UK, we also run ACC Support UK and have a very active patient community there, supported by our medical advisory team. I'm a patient myself, not of ACC, but that's how I got involved with AMEND in the first place. So my co-chair here is Lorenzo Tucci, if you want to introduce yourself.
Hello, good morning to everyone. I am an Italian endocrinologist, currently doing my PhD on adrenocortical carcinoma, and it's really a great pleasure to co-chair this session with you, Joe.
Okay, I'm going to introduce our first speaker in this second session, who is going to talk about the psychological support for ACC patients throughout the patient journey. Professor Imad Maatouk is a doctor who specializes in the connection between physical health, mental well-being, and psychotherapy. He studied medicine in Göttingen and Paris before completing his training at Heidelberg University Hospital, where he later became a senior physician. There, he led psychotherapy wards and worked in psycho-oncology, supporting people with cancer through psychotherapy. In 2021, he moved to the University Medical Center in Würzburg to become Professor of Medical Psychosomatics and head of the Department of Psychosomatics, Psychotherapy, and Psycho-Oncology. Since 2024, he has also held the chair of Integrated Psychosomatic Medicine and Psychotherapy. His work focuses on helping people with physical illnesses maintain good mental health and quality of life. He develops new treatment approaches, including therapy programs that combine different methods and digital tools, especially for patients with cancer. At the heart of his work is a strong belief that even as modern medicine becomes more advanced, the individual patient's needs and well-being must remain central. So I welcome Professor Maatouk, if you're there and you'd like to share your slides.
So thank you very much for the opportunity to speak to you here today about psychosocial and psychological support throughout the patient journey. Why is this a very important topic? Cancer is never only a medical condition. It affects body, mind, and social life. And patients often experience distress, fear, such as fear of progression and depressive symptoms as a natural reaction to an overwhelming situation. And we know from research that psychological well-being strongly affects quality of life and sometimes even treatment outcomes. And this is why psychological support has become a crucial part of modern cancer care. What is the history of psychosocial care in cancer? It is not new. In the 60s and 70s, there were pioneers in the US and in the UK that established first services at Memorial Sloan Kettering Center in New York. Nurses and social workers, together with psychiatrists, offered the first psychosocial consultations. And in the UK, it was Cicely Saunders who invented and founded the hospice movement and reminded us, listen to your patients, they will tell you what they need. And since then, psychosocial oncology has become a part of clinical care, research, and teaching. Nowadays, it is supported by different guidelines from ESMO, from NCCN, and also the German S3 guideline. Medical progress means more patients live longer with or after cancer treatment. But survivorship brings new challenges, such as physical symptoms, fatigue, pain, or cognitive impairments that can persist for a long time, even after finishing the treatment. Anxiety symptoms or depressive symptoms are very common. About half of the patients with cancer suffer from those symptoms. And many patients also feel isolated, lacking adequate social support. This underlines that cancer care must be biopsychosocial, addressing the whole person, not only his tumor disease. Today, we have the opportunity to screen for distress in a simple way. We have screening instruments such as the distress thermometer. It is a one-item visual scale available in more than 70 languages, followed by a short checklist. And international studies show us that up to 60% of all cancer patients suffer from increased distress. About 40% of all patients meet the criteria for a mental disorder, in most cases an anxiety disorder or depression. Importantly, the need for support is often independent of the actual medical status. In ACC, there's a unique dimension that is added. It is a rare and aggressive, sometimes aggressive and often unpredictable disease. Treatments are long and demanding because of the side effects. And because of the disease is so rare, patients often do not find peers to share experiences with compared to other diseases. This combination leads to a particularly high psychological burden, or can lead to a high psychological burden. Together with our colleagues here in Würzburg, we conducted the first systematic study on psychological needs in ACC, and we included over 100 patients and used standardized tools to measure psychological burden, such as the distress thermometer, the PHQ-9 for depressive symptoms, and a fear of progression questionnaire, and a measurement of health-related quality of life. To the best of my knowledge, it is the first systematic study on psychological needs in ACC. And we need more studies to develop also the treatment possibilities. What were our key findings? We had a higher level of distress than in other diseases. About 62% had high distress, 59% reported very high fear of progression, and about 40% showed major depressive symptoms, and 80% in our study needed psychosomatic counseling. These numbers are much higher than in many other cancer populations, and interestingly, the burden was independent of tumor stage or treatment, meaning even patients who were tumor-free reported significant distress. But only about 1/3 accepted the offer of counseling, which is interesting. So we discussed about possible barriers and why do so many patients decline help in this context. We identified several barriers, such as fear of stigma, prejudices, or self-restraint. What do others think of me versus I must deal with it myself, and also practical issues such as limited mobility and lack of time. lack of psychosocial specialists familiar with rare diseases is another important barrier. And this shows that offering help is not enough. We must also remove those barriers. So what kind of supports help? What possibilities do we offer? There's information and education, crisis intervention. We need to empower patients with knowledge, supportive consultations focusing on resources and strengths. We have mindful-based interventions to offer to reduce stress and improve coping, and also specific strategies, psychotherapy, to deal with the fear of progression. One important psychotherapy is the acceptance and commitment therapy that is based on different pillars. It encourages patients to connect with the present moment, such as in mindfulness interventions, and to clarify their personal values and to accept what cannot be changed while still pursuing meaningful goals. And we work with metaphors in acceptance and commitment therapy. And this is one well-known metaphor. We have this guy here walking on his way to a nice place, and there's something that is not good, such as the disease and thoughts and feelings, and what is to do. And we work many hours with the patients to integrate what cannot be changed, and to yes, go his way with the disease and everything what is around. So it's finished. So let me summarize. Psychological support is not optional. It is essential throughout the patient journey. And distress, fear, and depression are common, and they affect quality of life regardless of the tumor status. And support should be offered to all patients, not only those with advanced disease. We must overcome barriers and empower patients to accept help. Living with ACC is not only a medical challenge, it is also an emotional one. And psychological support can make this journey less lonely, maybe more manageable and more hopeful. And thank you very much for your attention. And I would be delighted if you could post your questions in the Q&A box. Thank you.
Thank you very much, Imad. This is psychological support of patients with all of the diseases that we cover is a real passion of mine, and we're lucky to have a psychological counselling service, but there's actually quite a low uptake of the service with the ACC patients. So, as the professor just said, Q&A, please put your questions for the professor in the Q&A. Over to you, Lorenzo.